Let's start out with another GSW, but this time, instead of the chest, we'll talk about a GSW to the abdomen. All right, so what is the most important thing or the most vital thing to think about? In this patient, it's going to be obviously their vital signs, okay? So someone comes in with a penetrating wound to their abdomen, and their heart rate is 150, and their blood pressure is 80/30, okay? What are you thinking? Well, hemorrhage, 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 hemorrhage. So this is a major problem. So we always, no matter what, we start with our primary survey. So this patient's airway is intact. There's bilateral breath sounds. There's circulation. Now this is a big problem here. So we're gonna wanna start blood. I always say that MTP, we can give whole blood at our facility. And let's say this is a 30-year-old male. So at our institution, I would start with whole blood. And we need to make sure we have really good intravenous access, whether that's 2 large bore peripheral IVs, or in this case, we would probably get central access with a cordis catheter to really start slamming this patient with blood products. A, B, C, D, he's moving all extremities. Now that's important. A GSW here, a penetrating injury to the abdomen. We're always concerned about the spinal cord. So he's moving all 4 extremities. He's following commands. He's opening his eyes spontaneously, and he's answering questions appropriately. So his GCS is 15. Then what's also important in penetrating injuries now in our primary survey is E, exposure. So we expose the patient, and there is what appears to be a wound here and a wound here on their right side. So like their right flank and their right mid-abdomen, or the mid-abdomen and the right flank, call it. Okay, so we expose the patient. So then what's important next is our adjuncts, which are gonna be a chest x-ray, a pelvis x-ray, and then a fast exam, which is extremely important in this scenario. So you do your chest x-ray, you don't see anything. You do your abdominal x-ray, or excuse me, your pelvic x-ray, you also don't see anything. And then you do your fast exam, focused abdominal sonography for trauma. And your fast is positive, so there's free fluid. Where does this patient belong? There's only 2 places where people go from the trauma bay. CT scanner, in this case, clean kill. Don't do it. This patient belongs in the operating room for an X-lap, an exploratory laparotomy.